this evening. Wonderful. All right, so welcome again to our general weekly group. I am Wendy Myers. I'm one of the senior clinical managers, social worker at Cancer Bridges. And we're excited we do this, a couple times a year. We're trying to do it more often because we have so many amazing books to review. So tonight we're doing one of our book talks. And I want to introduce the two people that were instrumental in developing these book talks. And actually was one of the authors. He's also a cancer survivor, Brad Buchanan. He's joining us all the way from the West Coast. So we're excited to have Brad here. And then we have our lovely Dr. Josie Van London, who many of you know, and she is a physician as well as a cancer survivor, as well as just an amazing wealth of knowledge. She has her own podcasts. She has her own Instagram it's called Cancer Survivor MD. I think that's right, Josie? And so Brad and Josie put their heads together along with Jen and myself, and we kind of created this book talk. And so here we are. And tonight we have one of our own who actually presented a couple months ago on this group, although she's going to do a little different vibe on this, her amazing new book. And I'm going to let Jen introduce her. So everybody get comfortable. Please stay on mute because you are being recorded. And then we'll have a chance for some questions later. So take it away, Miss Jennifer.
Thank you, Wendy. So I am Jen Kem. I'm the program and development coordinator at Cancer Bridges, also a survivor. And this is Jill's book, which we have multiple copies. I know Dr. Josie has it as well. But I have known Jill for a long time. She's a facilitator at Cancer Bridges as well as I'll read you her bio because it's pretty amazing. Jill Squire is a longtime registered nurse with over a decade of experience in oncology nursing, navigation, and case management. She is a devoted cancer support group facilitator for Cancer Bridges and holds the members and leadership team in the highest regard. As an avid content creator and podcast host, and the well received informational yet keep it real everything cancer podcast, which a segue if you haven't, our executive director was interviewed, Stephanie Serrani, and it was an excellent podcast, but with both of you. It's called Everything Cancer Podcast. You can look it for wherever you can find podcasts. Jill is passionate about developing survivor-centric contract content, providing education and collaborating with professionals to improve survivorship access, and standards. She is committed to empowering survivors and guiding them toward efficient, effective, and self-advocacy shared decision making with their healthcare team. Jill published this book, which is what we're talking about tonight, Cancer Journey Guide and Journals, Empowerment and Diagnosis and Treatment and Beyond, in this February of 2024, with electronic versions set to be available on Amazon by the end of September. That's fantastic. And she's also co-representing a webinar on shared decision making through the National Coalition of Cancer Survivorship at the end of October. That's amazing. Jill is applying for grants this fall and hopes to be hearing more from her soon. I can't say enough about Jill. I have gone through the book and it's amazing. There's so much content that is so relevant, whether you're newly diagnosed or you're, out of treatment, but still just trying to navigate through survivorship. So with that, I will turn you over to Jill, and I'm gonna unspotlight myself and Wendy so that everyone can discuss.
I'm so honored to be here. And Jen, I feel like you're talking about someone else. Even I kind of threw that together. And Brad, I waved when Wendy said your name because I heard about you through Michelle Kirshner, who I'm getting to know very well. And I was waving hi, not I'm Brad. Um, Josie, it's an honor to meet you.
Same here, Jill. I'm very, very excited. This is a very heavy book, by the way. It's a very thick book. And I know you've spoken about this book here before, but I don't know how many people here were there then. So I was going to repeat just a little bit, an overview of the book, and ask you a few questions.
Sure.
And as usual, we also take questions from the audience, and we'll just fill the hour. Usually we start on time, although we were a few minutes late. So we like to finish on time, maybe depending on how things go, a few minutes late. And then hopefully you will have learned something new here today and you feel empowered, which is always the goal of these particular sessions. This book, my summary of it, is just amazing. It has a font, first of all, that's readable. It's large, not too dense word choice. It's very easy to read, even if you have chemo brain, or brain fog. There's not too many words, just enough to know where to go and get more information. And it touches on everything you need to know when you've been newly diagnosed with cancer and moving forwards on your whole journey, including the long-term survivorship phase, which many of you are. And it's just empowering how it captures the various things that you can help yourself, or knowing where to go if you need help beyond what you can do for yourself, and how to formulate questions, and what if you lack trust in your providers. In a second, Jill will put up the table of content, and if she's willing to, then maybe page a little bit through it, because I think at least 75% of the book is for you to fill out. It contains empty forms that you can use to track your symptoms, to track your medications, to track your doctors, your appointments, what was discussed in the appointments. I mean, it goes on and on and on. And all of it is super helpful. And you can tear it out, you can leave it in the book and just take your book with you when you go to your appointments. The other thing that I thought is funny, in the end, there's 2 pages, I think, that are a collection of jokes and things that make you laugh and smile, which goes to say that humor plays a very important role in your coping mechanisms too. And so I will hand it over to Jill, and maybe she can show a little bit what the book is about. And I had two main questions to ask Jill while she does that. One is what made you write this book? What was the big driver? And because I don't think anybody else has created a book like this. This is very unique in how it has a very easy to grasp knowledge and information combined with a workbook that you can use to track everything in your life. Health wise, it's not out there as far as I know, not to this professional degree, written by a nurse. And so what made you write this, and who did you intend to write the book for? And now I'll be quiet.
Thank you so much, Dr. Van Lunden, for that amazing introduction. This book is written for anybody facing a tough diagnosis, anywhere on that continuum. And the reason why I wrote it, and it is directed towards people dealing with cancer, which is obvious by the content, but I think almost anybody can pick it up that's dealing with something that they're going to be dealing with that's tough, and they need to advocate for themselves for the rest of their life, and need to track their symptoms. That's a really tough thing to have to do. And not only are you having to advocate for yourself and formulate your thoughts for your healthcare team, but also with your family, because sometimes you find yourself at opposite ends of the spectrum, and that can be a really tough place to be, and they're not in your shoes. And so you need to learn how to be a good listener with them, but you also need to learn how to understand where you're coming from, formulate those thoughts, have a good outcome in those conversations, and hopefully help them learn how to advocate for you. If not, then agree to disagree, but ultimately end up with a supportive relationship. It's really hard when you don't. The reason I ultimately put this together, and it was a 4-year goal to put it together, was as a navigator. I navigated for 3 years. One, I did gynae oncology for a year and a half, and then it's actually almost 4 years. And then I was lead navigator for 2.5 years. And so I covered all the areas and worked with all the navigators there. And I came across so many gaps in care that were inadvertent. But if someone had known how to advocate for themselves, or understood advocating for themselves, or understood their treatment plan better, I'm not putting the onus on the patient at all. It doesn't belong there. But maybe some of those gaps in care might have been avoided. But also, shared decision making didn't happen where maybe it should have. And so that became really important to me. And it's become much more prevalent, but it still isn't where it needs to be. And so that it was born of that. That became very evident to me also as a case manager. And then facilitating the support group only supported that idea. And so I became very passionate about effective self-advocacy, empowerment, and shared decision making.
Jill, 1 second, because I see some faces, I think, with a little question mark.
Yeah.
Not everybody here may understand the concept of shared decision making. I wonder if you would be willing to expand a little bit
Sure.
on that.
Sure.
While it looks like you're pulling up something there, but let me tell the group here that you can hear Jill is a very kind soul, and she is not in this field for profit. She's
No.
in this field for empowerment, which makes the difference. You can read her soul, how desperate we need people like Jill, but I think she understood that there needs to be more people than just Jill, and the only way she can do that is by writing a book to help those. Now I'm going to sidetrack a little bit, but the survivorship field as a whole is struggling with how to help all of you. And there's different ways in which it's proposed that we can do this, and different levels depending on how much support somebody needs. And the lower level of support is self-help materials, and that is where this book fits in. You can help yourself. Most of you don't need anything beyond that, but if you do, then that book hopefully will make you feel empowered enough to say, hey, you need to refer me on to a higher level of support so I can be helped. And that is, I think, where your book fits in, Jill. But it sounds like from your introduction, you're working on other clinical resources to be more hands-on. Still have a clinical connection with individuals, because some do need a little bit more help. So shared decision making, to go back to where I left Jill, is in short the fact that a provider and a patient talk together and discuss the pros and cons of a particular medical intervention, and together decide what is best for the patient. The physician provider doesn't decide for the patient doesn't decide on their own, they decide together. At the end of the day, though, it's patient's decision, but you get my point. It's how my late mentor used to say, it's an informed conversation that leads you, your patient, to make a decision. Jill, take it from me.
I have a really good example of that from a few years ago. there was a patient who was very in tune with their job, and their job was very important to them. And they were on a maintenance treatment that their provider had recommended to them, and they were finding it really hard to go to work and engage in work. And it was the optimal treatment. And they sat down with their provider and said, I can't make it to work every day on this treatment, and I want it cut back in frequency. And their provider, their oncologist replied, it was a short, I mean, this is really boiling it down. You will have a higher chance of recurrence if you have your treatment less frequently. And the patient's response was, but my life isn't worth living doing not being able to do what I want to do. And I want to be able to engage in my work because it has that much value to me. And I want to be able to spend time with my family, enjoying time with my family. And so they agreed together to decrease by half his treatment intervals. And he now has three, and has had for quite some time, 3 good weeks in between. He recovers well. He is fully engaged in work. He's fully engaged in life, and he's going on vacations. And he is entering that knowing that his life may, in fact, be shorter, but he is enjoying it much more. So that was a shared decision. It was an informed decision. It was a shared decision. But his point to his oncologist was that he was miserable the other way. And that's a fairly stark example, but it's a real example. It's an example that actually occurred. And another example I have is a patient who had a strong belief in faith for control of her symptoms. And her oncologist was pretty insistent on antiemetics. And she said to her oncologist, I don't want them. I want to use faith to try and control my symptoms for as long as I can. And her oncologist agreed that they would go for as long as they could, and her oncologist would try and not give as much with the treatments as much as they could. And actually, this patient probably did better than I've ever seen anybody do through really tough treatments without as much upfront anti-emetic medication. She eventually did say to her oncologist, okay, I'm ready. But they communicated every single treatment about how she was doing. And I wouldn't be one bit surprised if that oncologist ends up presenting that patient at a conference down the road. But it was a shared decision on what was important to that patient to try. And the decision wasn't taken away from her by the oncologist saying, this is our protocol that we follow. And the oncologist just explained to her that it's really important you stay hydrated. It's really important you're able to drink, and you need to tell me when you're not able to anymore.
Yeah. Yeah, I like that. There's so much in what you're saying that deserves its own discussion.
Yes.
Um, I usually compare it to Eeyore and Tigger. We're all different.
Uh-huh.
And we need to find a treatment or a medical decision that fits with who you are, how you stand in life. And some of you are like Tigger, like you want to deal with it like now, bouncing up and down. And some of you might be like Eeyore, well, I'll deal with it when it flies in my face, and maybe then I still won't deal with it. And so everybody makes their own decisions. We may not agree with your decision, but as long as you're cognitively intact, then we have to accept what you're deciding. And so I think in a nutshell, this book is about you understanding that you have a voice, that you can ask about your questions, your complaints, no matter how minor they are, compared to your life and death scenario. Even hot flashes overnight can be a big hinder on your quality of life, your sleeping, your ability to function during the day. And so This book, I think, is about empowerment. But Jill, would you like to share your screen and maybe go through the table of contents to show people? And then there's a
Sure.
few things in table of contents that we could zoom in just a tiny bit. And I think Brad will have a lot to say about that then.
Brad, you look like you had a question.
Yeah, go ahead.
Well, I do have a question. I don't know if it's the right time for it, but I was just going to comment from a patient's perspective. I think your book would be really helpful because the thing that people don't want to seem is they don't want to seem stupid, right? They don't want to seem like they're saying something dumb, uh, and giving them the confidence to be a good advocate for themselves is really important if you want that shared decision making that we're talking about, right?
Yeah.
But and I guess what I'm getting at is having this journal, this workbook, is a place for you to record all the details of each visit so that you are prepared for the next one, and you can go in, with the right tools in your toolbox, so to speak. Because I took about 7 different chemo drugs at various points, and I couldn't always remember the names of each of them. And then they decided to change the regimen a little bit. Anyway, the long and the short of it is, I think patients really do need to feel confident enough to be good self-advocates and to participate in shared decision making. And your book really seems like it's going to be an important tool for people in that regard. So I salute you for that. My question was about the birding nurse and, and whether that has any, like, I think it's important to remember that your patients are full human beings with interest
Mm-hmm.
inside their disease. And I think it's really great that there are nurses and medical professionals with pursuits and passions outside of their profession. But I wonder if that passion, if that, outlet that you have on social media and so forth is, it plays a role somehow, in your approach to medicine, to treatment, to your career, etc.
I encourage people to make sure that they're able to do something they can enjoy. And I also bring that up in self-advocacy, and to outline what's important to you. And birding is important to me. It's my Zen place. And sometimes there are days or weeks I have to remind myself to do something I enjoy. It's really easy to get pulled into, as you know, Brad, as a writer, into getting too involved in the creative process, and you need a break. You need a break from it. So I hope that answered your question. I'm going to share my screen, and I just need a minute to, uh, here we go. So can everybody see this now? This is just explains quickly how to use the journal. The first part is an outline of actual steps to advocating for yourself and being empowered. And the second part are the journals, which is a key part of being empowered.
Yeah.
And this is the table of contents to the empowerment piece. These are the basics of effective self-advocacy. And as you can see, several of them can be listed on the same page. And as Dr. Van London had pointed out, these are intended to be very short and easy to read. I intentionally, with intent, with meaning, stayed away from being overwhelming and going on with content. You're already overwhelmed. Short and to the point, yet compassionate is what I aimed for. And lack of trust in your doctor, that's a really big deal because you need to be able to communicate with your doctor. And so I really do go into a lot of steps on how to address that, but address it in a way that's comfortable. As you can see, we're talking here about listening well, the power of being direct, respectful, polite, making your provider aware of changes in your body, writing down your questions, which we were talking about, having a person with you, a second set of ears, understanding your diagnosis, understanding your treatment plan decision, and we go into that a part of shared decision making, but we get more in depthly into that later. The getting a second opinion, everybody should do that. If nothing else, if it agrees with your current treatment plan, it gives you confidence in your current treatment plan. Asking for tumor board review of your diagnosis. Here you go. Give your mind a break. Practicing mindfulness. The mind's burning. Accept responsibility for your personal wellness decisions. That's also a keystone of self-advocacy, is accepting responsibility for your personal wellness decisions. Everybody, most of you, I'm sure, track your tumor markers, your lab work, asking for and accepting help, writing, and this is where it comes to tough conversations. Writing down talking points if anticipating a tough conversation, and then approach a tough conversation with the intent for a positive outcome. And it goes into that because if you have that mindset of, okay, I'm writing down these talking points, and there's a journal for that, and then approach it with an intent for a positive outcome. Even if you don't end up with a positive outcome in that particular conversation because of the way you handled yourself, more than likely you're going to end up with a positive outcome down the road because of how you handled yourself. Build a strong cancer care team, work with your HR department or leave administrator. That's tough for everyone. And understanding your health insurance benefits. We go into deciding on a treatment plan if you're of childbearing age, wrapping your head around your treatment plan, which Brad, we just talked about. Be prepared for a change in plans. Important shareables based on my experience. This was based on my navigation and case management experience, dealing with an ostomy and dealing with a feeding tube, because people have a lot of fear about those two things. And it's more a reassuring narrative about both of those and why, and then sources to go to of other people that have had both of those that live very full lives. And it's not just a positivity website. It is truly people that have had either of those and really give in-depth insight into what it's like. And it does do a lot to understand, and they'll answer questions and so on. Credible sources for information. Symptom management, the power of rehabilitation and prehabilitation, pelvic floor physical therapy, which is huge, palliative care. I'm going to be adding a chapter, by the way, on integrative health and integrative oncology, and then vaginal stenosis with radiation therapy or surgery. Your oncology team members who can be super teammates. And then deciding to no longer have treatment does not mean stop living life. That's a really tough conversation to have with your family. But they're not living in your shoes. And so it takes a lot of thought on your part to put forth what's important to you in that moment. And then what advanced directives, living wills, and substitute decision makers are, and in closing. So now we have our journal table of contents. And these are there's about 20 different guided journals, and that sounds like a lot, but actually it really does take a lot of stress off of you because everything is very well organized and you can find it immediately. And this is a draft, so you have to excuse me because it's actually much prettier in the book.
But I also think, Jill, that this is very helpful. Even if you, as the patient, I'm talking in generalities here, are not strong enough to fill this out, somebody else can fill this out for you, and you can use it as a when you're feeling better, as a way to look back at what happened with me at those times. How was I doing? What treatments did I get? So sort of a way to document and look back at later.
Yes, and they're all designed to be easy, as you saw Dr. Van London, to fill out. They're intentionally designed not to be overwhelming. And so I really took care to make sure of that in the design of these. And I had survivors review this prior to publishing it, and then it was also medically reviewed by a board certified hematologist and oncologist. All of the steps in self-advocacy are evidence-based. I have resources that back everything up. And I made sure, and I also, and Dr. Van Lunden can vouch also, and Wendy can too, that it's fairly comprehensive in practicing empowerment and self-empowerment and self-advocacy. So one of the things that I'd like to go to is what is important to you journal, and then talking points for conversations with those you hold dear. So that's a really compassionate way to put that. Talking points for conversations with those who you hold dear. Because you're anticipating possibly a tough conversation, but if you say with those you hold dear, that's a compassionate way of putting that, right? And so that is the approach of this, is to help you feel like you have a friend with you through this journey. And Jen actually kind of described it that way, Jen, and I thought that was a good way of putting it. There's also an intimacy and sexual health journal. Go ahead, Jen. What were you going to say?
Wait, you're muted. I think
Yeah.
she's saying, yeah.
Well, no, I just think, you're only with your physician for a short period of time. So having the opportunity to give them more data and more information is really powerful.
Yes. So I'll take you to that point. I'll take you quickly to the daily check-in, and then also your questions for your physician, because it's really important when you think of a question to write them down. And that is incredibly important to do. Questions for your healthcare team is on page 98. So we'll fly to that. I don't know how to do this quickly. Brad probably does. I could probably just type it in. I can just type that in, right, Brad?
Yeah.
Okay, there we go. Questions for your healthcare team. Date, physician, provider, or name, your question, and then there's a space for your answer.
Yep.
So you can write down the question for your answer. Now, let's say that you chicken out while you're in your meeting with your oncologist. You can look down at your question instead of maintaining eye contact and read it off. That can give you a sense of empowerment, and it gives you a break from their boring eyes. Or you can tell them a pun and see if you can get them to laugh and then ask your question. Or if you've brought someone with you, you can ask them to read the question for you. So there's a couple different things to do to have that question answered. Or you can ask if they have a scribe, like a nurse with them, or you can ask someone to come into the room with you and ask the question for you if you're chickening out. But it's really important that you ask it, because this is your diagnosis, your treatment, it's your life. And if you think of it that way, I think you hopefully will feel more empowered. One of my watershed moments in the past 6 months that made me realize how difficult empowerment is for many people in this space is, in spite of this book being put together, is a PhD in public health in my particular group and a physician both said to me in our group, is not just to me, it was in a general discussion, but I heard it. I'm terrified to ask my oncologist questions. And they both know the questions to ask. They know what to ask. And I asked why. We don't want to make them mad. We don't want them to think we're stupid. So the research that the grant I want to do is that I'm writing. There's 2 grants I'm writing, but one of them is to work with cohorts of people on this material. So I have a valid survey before and after on their comfort with self-advocacy, their sense of empowerment, and check in with them 1 month, 2 months, 4 months, 6 months, but also take their comments, such as those, about what it feels like to be in that provider office, that healthcare team member office, and collate them with the publication of the other results in a way that we can make the providers, the healthcare team members, aware of how, no matter how many times we say, if you have any questions, ask, how the patient feels, how the survivor feels sitting in the office. Because I think if we set that awareness up in a evidence-based publication, a research-based publication, and we do some very simple workshops around that and publish it in a evidence-based journal, I think just having that awareness and then having some conversations around how can we change the narrative in that appointment could really make a big difference in empowerment for the survivor.
Yes. Jill, I'm looking at the time, so I'm going to reroute you just a little bit. One question. When you're ready, when this grant gets awarded, is this a study that you were talking about?
Yes. Yes.
And you will be recruiting through, how will you recruit?
So I actually talked with the Gathering Place, and I was actually going to approach Cancer Bridges to see if we could work with cohorts of people there. And the Gathering Place is in Cleveland. They're 2 hours from me.
Yes.
And they send people into underserved communities. And I had a brief conversation with them about me actually accompanying their social workers into underserved communities to work with them there, which to me would be tremendous.
But that means for the people here listening or later on the podcast, there's the possibility that they could participate in your research as they wanted to. Okay.
Yes. And also I would like to potentially work with on a remote basis too. So I mean there's lots of listening later. So absolutely. And then daily check-in. I know we're running out of time here. Where did my book talk paper go? So daily check-in is on page. I'll go back to my table of contents, which I think was on page 6. Right around here. Sorry, I'm flying through this. Oh, here we go. That is on page 256. So I learned something new here. So this is a calendar, and we'll go ahead by 20 pages. This is a daily check-in. And this is just so you can take your pencil and mark how your day is going when you're having a particularly good day or a particularly bad day.
Yep.
This will help you with your conversations with your physician and tracking what is happening with your symptoms. Pain is not just pain, and the nature of the pain is really important. And I actually just interviewed a rheumatologist who is an oncology rheumatologist, and she said this is so important, especially with the immune checkpoint inhibitors, to understand the nature of the pain. It's important with neuropathy. So this helps you kind of distinguish it, and it helps you describe it to your doctor, but you're just having to mark it, and you can mark when it's happening, how it's happening. If you're having diarrhea, the nature of it is really important. Right here, you just mark it, and you can say what days it's happening and how many times in 24 hours. How much were you able to eat? How much were you able to drink? And exercise, that's so important. Exercise is so important. What were your concerns that day? What did you enjoy doing today? Brad, back to your point. That's so important. So, and then on your particularly good days or particularly bad days, you can mark those back in your daily here with your smiley face. And then you know to flip to the daily journal that shows that. So,
and even if you haven't had the energy to fill it out, that says something too. When you're reviewing your diary, this workbook to prepare for your doctor's appointment, not having filled it out says something about how you felt, either very bad or very good, and you were
right. And you can just write it in there for the date. So you can see that there's an entire week on a page spread, and you can just write it in. nauseated all day and just a smiley face or whatever you want to do. But you can also write your appointments in here and everything. There's a place to write down what's important to you. We were talking about shared decision making, and to that
Yep.
one woman, her faith was important to her. To the gentleman going to work was important to him. And then the talking points surrounding that. So you can express yourself to your family and to your healthcare team.
Very, very good. Jill, I'm very impressed. I have a question. If you wouldn't mind going to page 14, because I think that
Sure.
might be a topic we can discuss with the remainder of our time, which is step 10,
Mhm.
trust. In the meantime, I wanted to ask, are there any questions of the audience? Any questions that you wanted to ask Jill? Um, just to break things up a little bit. I can't see all of them, Jen, but I'm assuming you can. Is there anybody who has a question for Jill?
Yeah, I can
And
actually can't see them because I'm recording, but
oh,
you can put the questions in the chat too if you feel more
yeah,
comfortable that way.
yeah. Whether you say it verbally or you chat it, either way, I will delete you from the recording so that you won't be in the podcast. Um, but I'm assuming nobody's speaking up and nobody's writing, so I will just keep going with Jill. Jill, how about in the meantime, while people are maybe writing, let's look at step 10, because I think
Mhm.
as a provider, um, and as a patient, and Brad has been a patient, we've had tons of issues with trust on both sides of the table. And I thought, how about what all of you think about discussing this? I thought that might be a good topic for today, because that's this topic compared to all the other topics, I think has the largest content. It's practically a whole page. So let's go over this and fill the rest of the time. And we do have a question. Somebody's asking, is the book available electronically? And yes, go ahead, Jill.
At the end of the month, it will be. And so it's available in paper right now. I will say, if you want to use the journals, the paper version will be much less expensive than printing off the journals yourself. I can guarantee you of that. The paper version is $27.97. And it's 8 by 10. It's like 8 by 11. It's regular page sizes, so it's easy to use. I'm going to be making a smaller paper version, but I'll be making an electronic version. And then for people that don't read things like this quite as well and read a narrative version better, and where there's a case example of each, like we talked about, I'll be making a narrative version probably in October to publish for the steps in advocacy as self-advocacy as well.
Well, does that, I'm hopeful that that helps answer the question. I'm not mentioning your name with a purpose so that you remain anonymous. Okay, thank you so much. So step 10 is about addressing the lack of trust in your doctor. Um, I don't know what's the best way of doing this, Jill. Reading this from top to bottom is probably not the best way to spend our time. Is it possible that you summarize it perhaps in
Sure,
a few minutes and then
sure.
um go ahead.
Absolutely. Usually it's a misunderstanding. Not always, but usually. And usually, especially if you have moral support with you, or if you're able to talk with somebody else in the office, it can be resolved, but not always. And if you're still uncomfortable, you need to find a different provider, whether it's another provider in that office or another practice that you feel is just as competent in just as good in your specialty. That's really important too. But you have to feel free to communicate with your provider. That's imperative because advocating for yourself, communicating with yourself is imperative. What you can do is if there is an advanced practice practitioner, such as a physician assistant or a CRMP that you trust, you can see them instead and they can communicate with your provider. But you certainly can ask to switch to a different provider in that office or a different, if it's a CRMP or a PA that you're having an issue with, you can ask to switch to a different one in that same office. I hope that helps.
Yes. I'm going to back up just a little bit to build on what you said, because you really did it in a nutshell. Um,
One point, Josie. I'm so sorry.
go.
Absolutely and positively do not delay your treatment or skip a
Yeah.
treatment because of this, because that can affect your outcome. So still go and have your treatments while you're switching providers, and you can work with your insurer and you can reach out to your insurance company to find someone who, if it's not working in that practice, to find someone. Anyway, go ahead, Dr. Van London.
No, what you're alluding to is that your connection with your provider is a relationship,
Yes.
and any relationship can have an issue at some point.
Mm.
And I think what is important that Jill describes is step back a second and look at what is going on here. Um, Very often patients were angry with me because they were not able to reach me or I never answered them. And they were angry with me, but I had never any idea that they were even trying to find me. And so I would take a step back and see what is happening and explore why it's happening. Um, Maybe the anger at me wasn't necessarily I wasn't at fault, is what I'm trying to say. And so try to explore why something happened. Try to see um if whatever happened can be improved upon, sort of a negotiation and exploration. And depending on how they respond, and maybe you give them a trial period of trying to see, hey, will this really go better now? Um, then decide if you can stay with them and give them a second chance, or if you have to switch. Um, and all of this can be difficult because there's not many. If you're in a city, it's different than when you live in a rural area where you're really dependent on maybe one provider. Um, if you're switching to a provider, another provider in the same office, um, you don't have to explain yourself. You just want to switch, and that should be it. Sometimes individuals get a little bit of pushback from the staff, the front staff, or office manager, but you should not have to explain yourself. Um, and they should not give you any resistance switching to another provider in the same office. If you need records to go from one office to the other, that should just happen without you needing to explain why. Most of the time, they refer you to a generic medical record office anyway. These medical records are not handled by the particular office anymore. Um, but I think this is very, very relevant because depending on how you trust your provider, you feel better about sharing what's going on with you. You can address your concerns more thoroughly. You make better decisions. You feel at peace about the path you've chosen. And at the end of the day, that makes your soul feel good. And if you don't have that click with your provider, it can really cost you numerous nights of loss of sleep and concern and stress that none of us need. We already have enough on our plate. We don't need an extra layer of stress. Um, I think that is my nutshell. I was going to ask Brett if he's still here, because I know he's had his fair share of trust. For good and bad with providers. I don't know how comfortable you feel sharing anything, but you don't have to. I'm putting you on the spot here.
Well, yeah, I mean, I've dealt with the dozens and dozens of different doctors, and yeah, some of them I don't feel understood the nature of my diseases. So I mean, I strongly echo, you know, what's already been said about getting a second opinion. Um, I also, you know, I was in the hospital for like extended periods, And I was getting to the point where I was like, they would come to me and ask, which nurses do you want? Because anyway, I was in very intensive daily contact with nurses. And I didn't know you could say, I don't want nurse X on the case today, because there'd been problems, or there was a lack of trust, or whatever it was. Um, Hopefully, like, I'm hoping that most patients never get that familiar with the medical staff of their institution. But I did, and I had no idea that I had the power, to say, no, nurse X doesn't do a good job of accessing my port line or whatever. Um, so yeah, I think patients have a lot more autonomy in some ways than they know. But I don't really want to get bogged down in experiences with individual doctors,
No, no, no.
but I will say, like, it's important to recognize that there are differences in levels of expertise and seniority. Um, and what I would always say is, if you're getting bad news from someone who is junior to the usual people that you talk to, wait until you hear from their boss or the person who's in charge. Because there was one experience in particular where a junior doctor came in and decided to unload some what he thought was bad news that I needed to hear. He ended up being wrong, but you know, I made a bit of a fuss and said, next time you have bad news to tell me, bring in, my actual doctor who's in charge and who is senior to this junior fellow, so that I'm hearing it from the person with the most authority, the most experience, you know. But yeah, this is a tough issue. It's also an emotional issue, because when we feel our trust has been betrayed or misplaced in our medical team, it's very, very upsetting, and it it takes a lot to get over that. But that maybe is another issue.
Yes, by no means can we satisfy this topic in the little time we have. But I thought this might be a good topic maybe to end with, um, for today at least. So let me remind everybody that somebody has put in, thank you, links in the chat, that if you wanted to save them after the Zoom room closes, just open them. So they open in the browser and they stay open after Zoom closes. Are there any questions from the audience? Does anybody else have any questions for Brad and Jill, or anybody else here? Me. Uh, Jill, would you? Well, no, that doesn't help. I can't see anybody. Um, I guess unmute yourself or write something in the
Um,
chat. Go ahead.
oh, I was just going to say that I thought a good way to end this, but I'm happy to take questions or listen to questions.
Oh, here are the
But
fun puns.
yes, here's the fun.
Yeah,
I thought we could end on a pun.
yeah.
And what did the pencil sharpener say to the pencil? Stop going in circles and get to the point. So if you're having a really intense conversation and people are starting to get it at each other's throats, or with a family discussion, or you have a doctor who never smiles, you can pull this out, or you just need to uplift yourself, or you have kids visiting you and you need a way to entertain them. You can pull the last 2 pages of this out.
I like this. It brought a smile to my face. Thank you, Jill. I thank you, everybody. This is a different kind of book than we usually do. But I thought this book is great for you or anybody else who hopefully never has to go down this journey. Thank you, Jill, for doing this. I have a feeling we will hear more of you in the near future. Just keep us posted if we can help you with recruitment.
Thank you for having me. It means a lot. It really does. And thank you for all your praise.
Thank you, everybody. Somebody is saying this was very informative and a great presentation. Yes. Thank you, thank you, thank you. Thank you, everybody.
Thank you. Thank you, Jill. Thank you, Dr. Van London. Thank you, Brad. I'll stop the recording.